I guess the thing that I would want to emphasize is, unfortunately, these decisions really do matter. And these decisions impact the doctors people can see, the hospitals they can go to, how much they can pay, how much they will pay, whether their drugs are covered. All of this matters.
Welcome to Decoding Retirement, the show that helps you cut through the noise and make smarter decisions about your money in retirement. We're continuing our Medicare Open Enrollment Week, where each day we dive into one key topic that will make open enrollment easier to navigate and less overwhelming. If there is one tool you absolutely need to know about before making your decision, it's the Medicare Plan Finder. And joining me to break it all down, to cut through the confusion, is Tricia Neuman. She's a Senior Vice President with KFF and Executive Director for Program on Medicare Policy. Tricia, welcome.
Thank you so much. It's great to be with you.
It's great to have you here, and it will be great to have you sort of walk us through what people need to know about Medicare Plan Finder. So first off, let's start with what is it and what is it designed to do?
The Medicare Plan Finder is an online tool created by the federal government, by the Medicare program, to help people on Medicare make coverage decisions. That could be decisions related to traditional Medicare, supplemental coverage, and Part D prescription drugs. And it could be decisions related to Medicare Advantage and which plans to choose. I don't know how effective I will be in making this less complicated, because the reality is, no matter how much you know about this, it's actually quite complicated, but it is a really helpful resource. So it's important to know that it's there and what it can tell you. I do think before even getting to the Medicare Plan Finder, it's important to think about what really matters to any given person when choosing a Medicare coverage option, because you kind of want to think that through before you go and you're faced with a zillion options that vary in all sorts of ways. For example, some people prefer traditional Medicare for reasons, and some people prefer Medicare Advantage. That's a good decision to make before you even get to the Plan Finder, because you want to know what path you want to go down to find out what your options are before you get there. They're asking you questions and you really have no idea. So for my money, that is the starting point. And then going to the Plan Finder is a way to choose among options once you've made that pretty fundamental decision.
Yeah. So I spent some time on the Medicare Plan Finder this morning just trying to navigate it. And the very first thing that you notice is that you're given a choice to look at whether you want to look at Part C plans, Medicare Advantage plans, Part D plans, prescription drug, or Medigap. Let's focus on Medicare Advantage for a second. When you think about helping people choose the plan that's best for them from a Medicare Advantage perspective, there are a number of things you could search for. You could search by whether you want an HMO or a PPO, by plan benefits, by insurance carriers, by star ratings, by drug coverage, if you want a bundled approach, by star ratings. And then you also have the option of looking at all the filters. And ultimately, I found it hard to navigate. And I know you said that you might not be able to uncomplicate everything, but maybe walk us through what you need to know about that.
Right. Well, that's why, one of the things I talk to people about is asking them, like, what's really important to you? There are people with limited incomes who say, I need a plan that's going to have no premium other than the Part B premium and modest cost sharing. And I cannot afford to choose a plan based on my doctor, because if it's more expensive, it has higher costs, I can't do it. There are other people who say, sure, I want to go with Medicare Advantage, but it's extremely important to me that I can see my 3 specialists. That takes digging. But the first question is, what's most important? But there are caveats. It's really it takes a lot of work and a lot of clicks in order to get to the bottom of the details of a plan. And it's the details that actually really matter.
Yeah. When I was going through Plan Finder this morning, I just picked 2 plans. And what it showed me was a difference in copays and premiums, in-network costs, and out-of-network costs, et cetera. How do you, and of course, it's not in a spreadsheet, so it's not like I have to
No,
sort of visually compare and contrast these things, and there's no green arrow going up or a red arrow going down.
right,
What
right.
advice do you have for people as to try to navigate the costs that are involved in all this?
I would say don't get distracted by the premium because the premiums are not a good proxy for what costs will be. It might be useful to look at the out-of-pocket limit because plans do have an out-of-pocket limit for Medicare covered benefits, and they vary a lot, and they also differ for in-work and out-of-network. So that is one fixed thing that can be compared across plans. Um, I'll tell you, it's really hard to compare provider networks. It's really hard. My dream would be that the Medicare Plan Finder would allow people to enter in Dr. Jones, Dr. So and so Jones, with a location, and you could see all the plans where Dr. Jones is in network. But instead, each plan has its own network, and someone will need to go to each each plan in the plan finder in order to get network information. Now, I understand that in 2026, the links to the networks might be on the plan finder, but right now you actually have to you leave the plan finder and you're taken to the plan itself in order to get this information. So it's a lot of work, and it really does matter to some people. So unfortunately, my advice is you got to do the work or find somebody who will help you do the work because there are big differences across plans. We have an analysis that we're working on that does look at doctors and hospitals and plans. And what we're seeing is even within the same county, there's a lot of variation across plans in terms of how many doctors are in network. There's also huge variation in drug coverage, in extra benefits, in out-of-pocket limits. So, again, unfortunately, I can't say, "Here's an easy way to do it if you're gonna go to the plan finder." For people who have a tolerance for this kind of thing, who love to do research online, it's a really handy tool, but it takes a lot of work to get at the features of plans that can really make a difference.
Yeah. You mentioned prescription drug costs, and when I was looking at pharmacies that were in at least the bundled plans, what was interesting was it didn't tell me whether one was a standard pharmacy or a preferred pharmacy, and that matters to folks. Two things. One is maybe you can talk a little bit about what you're seeing with Part D plans, whether they're bundled or separate and apart. And then, what people need to know about finding the pharmacy where they'll get the best price because of the two different types of pharmacies that are out there.
Right, this also requires some digging for the standalone drug plans that go for traditional Medicare and with Medicare Advantage drug plans. It's really so people do need to check to see whether their drug is covered and at what cost, what tier. But it turns out pharmacy really matters. The Plan Finder has a feature where you can choose pharmacies that are in the area. So you can choose 3 or 4 pharmacies or maybe up to 5 plus mail order, and you can see how your costs may vary based on the pharmacy that you go to. It turns out that's a big cost driver. So there is an opportunity to enter that information and then compare plans. But what some people might want to do, like for some people who live in an area where there's one pharmacy that's convenient and all the rest are, 25 miles away, then it may be a good idea to go to multiple plans and enter in that one pharmacy and all the drugs and dose levels and all the other stuff to see what the cost will be for filling a prescription at that pharmacy under different plans.
Two questions about Medicare Advantage that I haven't asked yet, Tricia. One has to do with whether people should default to 4 and 5-star plans, and then how important are these additional benefits regarding hearing, dental, vision from your perspective, or silver sneakers, or whatever the case may be?
Okay, let's start with the stars. MedPAC, which is a congressional advisory panel, has looked at the star system and has said, you know what, we really need to rethink the star system because most plans are 4 or 5 stars. And, I think having very few stars might be a signal to stay away from a plan. But once you get to the 4 and 5 range, I'm not sure how important those distinctions are. I also don't know, based on some of the focus group work that we've done, how much people are really paying attention to the stars. It doesn't seem to be the most important factor for people who are really looking to get extra benefits or cut costs. So, I think it's kind of out there, and it might be a way to rule out plans. I'm not entirely sure it's a top factor to think about when choosing among better rated plans. And most plans have pretty good, it's a Lake Wobegon thing. A lot of people are getting good grades.
Yeah. And then vision, dental.
Yeah, I mean, look, everybody's pretty attracted to these extra benefits. Um, you know, Dental is an expensive consideration for people, hearing aids, vision. My advice there would be to, again, look beneath the surface because plans vary in these extra benefits and some are more valuable than others. For example, dental benefits often have dollar caps. So check to see, whether the cap will allow you to get an implant or whatever else you might need that could be quite expensive. There are also network restrictions on extra benefits. So an important question might be, is my preferred dentist in the dental network? So like everything else, that these extra benefits are super appealing. Um, and as one ad said, a buck's a buck, and it's a great thing. And I know people who love their silver sneakers. But I think, these are the shiny nickels. And for some people, the most important question is how much coverage will I get when I'm sick? Can I go where I need to go or want to go when I'm really sick? And what will I pay for chemotherapy or, the most expensive things to protect, for the protection that people want when they have a serious illness. I think in fairness, we-
Those are hard questions to answer, and there are a lot of surprises for folks who haven't asked those hard questions when they realize that their network out of network costs or even in network costs hit the maximum. So, Tricia, we're going to take a quick break, and when we come back, we'll talk about what retirees need to know about the SHIP programs and where else they can go to get help as they try to determine which is the best plan for them. So, don't go away. Welcome back to Decoding Retirement, where all week long we are looking to guide you through the Medicare open enrollment period. Before the break, we dove deep into Plan Finder, and now we're going to talk to Tricia Neuman about the SHIP programs and other places you can go to get help. So, Tricia, let's start with SHIP, what it stands for, and what is it that they do?
These are state health insurance and assistance programs. They are in every state, and the Medicare and You handbook typically has had telephone numbers and websites so that people can find the SHIP in their state. The SHIPs are staffed with professionals and volunteers who have been deeply trained in Medicare issues and coverage issues and other issues. Um, the SHIPs are the place to go when you need more one-on-one assistance. So there's 1-800-Medicare, which kind of provides high-level information. But typically when somebody's looking for help themselves, for their own situation, the SHIPs are a really great resource and are helpful in helping people decode um, what are the different options in their area, how do they make these decisions, what's most important as an individual? How do they find out, what's the best value for them given their preferences? And shift volunteers are trained to help people go through the steps, and they're also trained to help people once they enroll in a plan if they encounter a problem. So it's really sort of an untapped resource in the sense that they are everywhere, but not a lot of people know about them and not enough people use them. So it's great that you're asking this question because this is a great thing for people to know about.
You mentioned unbiased advice. People also have the opportunity to go find maybe a fee-only advisor who can help them sort through these plan options. Any thoughts about the degree to which someone might consider going above and beyond a SHIP advisor to a paid advisor?
I think if they're not satisfied with the information they get from the ships and feel that they want to spend the money on a paid advisor, that's not a bad idea. I would want to be sure that the paid advisor is as well trained as the ship counselors, and doesn't have any conflict in terms of or financial incentives to guide decisions one way or the other. There are a lot of I have encountered a few financial advisors who are not as well trained as the ship volunteers and have provided advice that hasn't been necessarily in the best interest of the people they've helped.
Yeah. So that I guess that brings me to the commission paid agents out
Yeah.
there. And to me, it's fraught with danger and conflict. So among other things, many of these agents get paid more to sell a Medicare Advantage plan than they do a Medigap plan. Or in some cases, they may not be getting paid to sell a Part D plan, so they may not tell you about it, et cetera, et cetera. What advice do you have for folks who might be going to a commission-based agent and navigate the conflicts that exist for them?
I think people may not understand how commissions work. We did focus groups, and what we heard from people were they trust insurance brokers. People are wanting one-on-one advice. They would much prefer to sit down with somebody than go to the Medicare Plan Finder, as helpful as that might be. But I don't think they necessarily understand that brokers may be paid more for guiding them in one direction versus another. Now, there's nothing to stop someone from asking that question. Like, are you paid more for suggesting I sign up for this option versus that option? But I'm not sure how comfortable people are in asking that question. But I guess my advice would be to ask that question because you want to make sure that the advice that you're given is in your best interest, not necessarily in the best interest of the broker.
Yeah. One thing I haven't asked Tricia is this notion that as we age, our fluency, our cognitive abilities perhaps decline a little bit. Research suggests that our financial literacy declines 1 to 2% per year as we age. And so for me, this decision about what is the best plan for me becomes increasingly difficult as I age. It's almost sinful what we ask older adults to do in terms of choosing a new Medicare plan each and every year. What advice do you have for folks who maybe as they age feel at times confident in the wrong decisions they're making?
I can't tell you how much I agree with you. I have heard so many people who I helped, 10 years ago when they were in their late 60s, and now they're in their late 70s. And I call them and I say, hey, it's the open enrollment season. Want to do it again? They're like, I'm too tired. I can't be bothered. It's too much effort. I'll just stick with what I have. And, that doesn't benefit them. That may not benefit them. And of course, I'm not going to say, no, 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 I insist. I'm going to, walk you through it. I do think it's an issue. We also did some research a while ago where we asked people whether they were comfortable working with their children and having their adult children help them. Uh, that kind of rubbed a bunch of people wrong too, because people like to be independent. So I think we have this real dilemma. We have people without cognitive impairments who may have health problems, who just can't be bothered with this. Because when you're sick, the last thing you want to do is go to the plan finder. So there's that cohort. And then, of course, there are people with cognitive issues that, if their cognitive issues are serious, you might hope that their adult children or family members or someone will step in to help them. But that's not always the case. And, we've just been talking about how complicated all of this is. So it's not at all clear that adult children are as prepared as they might need to be to help their aging parents with these increasingly complex choices.
Yeah, I can tell you as I look at this, what is it, 125-page book. It's hard enough to do my day job and then become an expert in this in the blink of an eye. So
I hear you.
So,
I hear you. Unfortunately, these decisions really do matter. And these decisions impact the doctors people can see, the hospitals they can go to, how much they can pay, how much they will pay, whether their drugs are covered. All of this matters. So it is, it is unfortunately a fair amount of work to sort through, but it's worth it.
yeah. I should mention before we wrap up, Tricia, that folks should go to kff.org to get a deeper analysis of what's going on with the trends across maybe their state, the number of plans that are being offered, the number of Part D plans, et cetera. It's a great
Thank you for that.
resource for everyone. So
We also
greatly-
have FAQs about the Medicare open enrollment period, which could be useful. We're putting out something about the SHIPs. So that too, the state health insurance and assistance programs. So we hope that's useful too. Thank you for that plug for us at kff.org.
Yeah, it's a great resource. I spend a lot of time there. I sign up for the daily newsletters and everything that's available. So thank you for all the work that you do in this area. It's extremely helpful to journalists and average people. So Trish, I want to thank you ever so much for sharing your knowledge and wisdom with us today. It's so greatly appreciated. Thank you.
It's been great. Thanks for having me.
Pleasure. So to recap today's episode of Decoding Retirement, we walk you through two important tools you need to use during Medicare's open enrollment period. The first is Plan Finder, which can be found at medicare.gov. It's a personalized tool that lets you plug in your meds, your doctors, your pharmacy, and extras to see which plan is best for you, your money, and your health. And the second is we talked about the SHIP program, which are offered to you for free. It's a state-based counseling service that will help you understand your coverage, answer questions, and help you make informed choices. And don't forget to stay tuned for more episodes in our 5-part series on Medicare's open enrollment, where we'll dive deeper tomorrow into Medicare Advantage plans.
This content was not intended to be financial advice and should not be used as a substitute for professional financial services.